Yes, hello, interpreter. So I have Mr. Carlos over here. Would you mind please introducing yourself? Good morning, Carlos. How you doing? I'm Dr. Evans. Thank you very much for coming in today. So let me open up your chart real quick here. And I heard from my nurse that we've been dealing with some concerning symptoms. In the meantime, we open this up because it's loading really slow. Can you tell me a little bit more about your symptoms? Why are we here today?
Pues la verdad es que yo no aguanto. Me falta el aire todo el tiempo. Hasta cuando estoy sentado siento que no puedo respirar. Y en la parte del pecho siento como, como si algo me estuviera apretando.
I hear you. Yes, that sounds very exhausting and scary too. You mentioned that it happens even when you're at rest, so it's not only when you're active?
Obvio, a veces cuando hago ejercicio o subo escaleras es mucho peor. Pero últimamente en las noches me suelo despertar con el pecho muy apretado y sintiendo que me ahogo.
Okay, so I want to be very precise about your symptoms because I don't want to miss anything. Let's start with the chest tightness. On a scale from 0 to 10, 10 being the worst you've ever felt, how intense is that tightness when it's the worst?
Verdaderamente un 7, pero no es un dolor punzante. Es simplemente como una presión, como si tuviera un peso encima del pecho. Y a veces siento que me falta el aire al mismo tiempo.
Okay. In the shortness of breath, do you feel like you cannot get air in or that you cannot get air out?
No puedo llenar mis pulmones. Quiero respirar hondo, pero siento que el pecho no se expande. Me quedo con la sensación de que el aire no llega hasta el fondo.
That's very helpful, thank you. Now, the chest pain itself, is it always associated with the breathing difficulty, or do you ever feel it out of nowhere just by itself on its own? Also, does it radiate anywhere else in your body? Maybe your arm, your jaw, your back?
Casi siempre va con una falta de aire. No me duele el brazo ni la mandíbula, pero a veces siento que me duele un poco la parte como de arriba de la espalda entre los omoplatos.
And when did all this start for you?
Hace aproximadamente unos 2 años. Al principio era solo como cuando jugaba fútbol o corría. Yo pensaba que era simplemente falta de condición física, pero esto empeoró. Ahora pasa hasta cuando estoy viendo televisión.
Do you notice any specific triggers, like a certain position, or maybe after eating, or if you're like in a very stressful situation?
Sí, definitivamente cuando me acuesto plano, por eso duermo con 2 almohadas. Y también después de comidas grandes o en grandes cantidades. Y bueno, el estrés, estoy estresado por esto mismo, así que no sé si es causa o consecuencia.
That makes sense, and it's an important clue. Laying flat and large meals making it worse often points us towards something involving the heart or the diaphragm. Have you ever had any episodes where you felt like you were going to pass out?
Dos veces, una vez en el trabajo tuve que sentarme en el piso porque veía todo borroso y otra vez fue desde una cena que sentía como si el corazón me latiera muy fuerte, rápido y me mareé mucho.
Now I need to ask you some personal questions, but they help us rule out any serious condition. Do you smoke, vape, or use any recreational drugs?
No, nada de eso. Ni siquiera tomo alcohol seguido. Tal vez cuanto mucho una cerveza al mes.
Good. Now, does anyone in your family, maybe your parents, your siblings, or grandparents, have a history of heart disease, heart attack, arrhythmias, or any lung conditions like asthma, COPD?
Mi abuelo materno murió de un ataque al corazón a los 50 años. Mi mamá, por otro lado, tiene presión alta. Y mi hermana mayor tiene asma.
This means that we have to take your symptoms seriously, but it also gives us a roadmap of what to look for. We are going to check your heart, your lungs, and also we're going to do a very thorough blood work on you, okay? I'd like to take a listen to your heart and lungs right now. I'm going to ask you to take deep breaths in and out through your mouth and relax your shoulders. Okay, breathe in, breathe out. Okay, again and again and again. Okay, so your lungs sound clear, which is good, no fluid or wheezing, but your heart does sound a little bit like with a slight extra beat. So I want to look into that more closely with an EKG. I'm gonna ask my nurse to help me with that. And also I want to place an order for an echocardiogram. And given your symptoms when laying flat, I want to check for something called pericardial effusion, which is fluid around the heart, or possibly another condition called HCM, which can also run in families. Here's what I want you to know. We are catching this right now, whatever it is, and you're in your 20s. So, this is exactly where we want to find things before they really become emergencies. So, whether it is a treatable arrhythmia, a valve issue, or a structural condition, most of these things can be managed very well with medication and lifestyle changes, sometimes with simple procedures. You are not alone in this. We are going to get the answers we need and we are going to build a treatment plan together so that you can feel better, okay? For now, I want you to avoid any intense physical activity, so no running, no lifting heavy weights, nothing like that, at least until we get the results back. And I will have my nurse do the EKG in about 10 minutes or so. We'll also schedule the echo for tomorrow morning or as soon as possible because I don't want to wait too long for this. And in case you're having these symptoms, let's say you feel a crushing chest pain that spreads to your jaw or to your arm, or you feel like you're going to faint or have a shortness of breath that doesn't go away and becomes severe, even if you're at rest, I want you to go to the ER immediately, okay? I don't want you taking any chances.
Sí, entiendo. Iré si eso pasa. ¿Y qué hago mientras tanto con esta ansiedad? Porque esto me tiene muy nervioso.
Yes, so Feeling anxiety, it's a normal response to not knowing, but we have a plan now, okay? So I don't want you to worry about what it's going to happen or what are going to be the results. Just know that we have a plan. We have the EKG today, the echo tomorrow. So now we have something to work with, okay? In case you're feeling that anxiety, maybe try sitting upright and taking really deep breaths. Also, like breathe in for 4 seconds and hold your breath for another 4 seconds and then exhale through your mouth for 6 seconds. But I also want you to like think and try to stay calm at least until we get the results, and then we'll see about what happens after. Okay?
Ok, gracias, doctora.
Oh, you're welcome, Carlos. So I'll see you back tomorrow after the echo. We'll get to the bottom of this, okay? So yes, after the echo, we're gonna have a follow-up appointment. So I'm gonna let the front desk know that we're just doing a follow-up, so they don't charge you for that, okay? So wait here. The nurse is gonna come right back in to the echo, and I'm sorry, to the EKG, and I'll see you tomorrow, okay? Okay, interpreter, thank you very much for your service. I'm sorry, mind repeating your ID again? Just because I forgot to write it down here. Okay, thank you very much. Have a good one, interpreter.